Hi class. So I'm not going to be there today, but I'm going to run you through the activity. So first, I just want you to respond in your notebook about how you think people learn about the genetics and health of an unborn fetus. So how do we actually gather that information? So you can pause and respond in your notebook. When you're done, then hit play again. Okay? So we're still on the same learning targets. This is I can explain how genes are inherited and their impact on human characteristics. So that's what we're looking at. We started off by looking at those karyotypes. So the first thing I want to do is actually talk about some of the homework information. I'm going to try and pull that up on here. And to be honest, without being in the classroom, I cannot remember which one I labeled with each of the karyotypes and the person's name, but I'll run through some of the responses. So if we looked at the people, Marta was the older woman on the back cabinet. She's probably about 60. Her karyotype should have been 46XX, so that's normal female. And then I believe Joe, so Joe was probably about a 20, I think in that picture he's probably about 20 years old. He's like a 20-year-old male. His was 46XY, so that's normal male. Then we saw William. William was, oh gosh, how old was he in that picture? Probably about 3 or so in that picture. Um, and he had glasses, and some people commented that his head was kind of tilted to the side when he was taking the picture, and his hair was blonde or fairly light. And he was 47XY plus 21, so meaning that he has Down syndrome. Then the battle became which karyotype was Sarah and which karyotype was Lily. So when we look at Sarah and Lily, it's a little bit hard, I think, particularly with Sarah, to determine anything unusual because she's so young in the picture, and unless you have a lot of experience, you're looking at some newborns, and it might be hard to pull out a few things. So we'll start with Lily. So if we looked at Lily, Lily in that picture is about 2 years old. She is tiny itty bitty, so she's having some developmental issues already. So some of them are internal with internal organs, and that's making some things visible. Like she's not the normal size of a toddler of about 2 years old. In fact, she looks incredibly skinny, especially if you look at her leg. She also appears to be quite weak because of that. So she doesn't have the same muscular development. She's probably not developing those same coordination skills at that age as most people would. So she's not walking. Okay, she's still struggling a lot with some of those things. So Lily Lily has Edwards syndrome, so she is 47XX plus 18. Okay, there's a lot of developmental issues that go along with that you've seen, hopefully, if you read through that article. So I'll leave it at that and we'll get back to it in just a second. And then when we look at Sarah, when you look at the image of Sarah, and I can't remember which letter was Sarah, well, Sarah, that leaves us with the 47XX plus 13, which is Patau syndrome. And Patau syndrome is actually the most serious. So with Patau syndrome, there's lots of internal organ developmental issues, which is also true for Edwards syndrome as well, but is specifically with Patau syndrome, the survival rate and survival ages is very low. Um, Looking at the image of Sarah, her eyes actually are not fully developed, so they look a little bit more sunken in than they should. Her hands are also not fully developed, so they look real kind of curled up because they're not totally developed. And it's also common for people with Patau syndrome to not have a fully developed head, like the top part of the head, and you can see she's wearing a hat, so that's covering that. Um, just so that you understand, the pictures of William, Sarah, and Lily are all from parents' blogs. So these are all parents who've had children with these disorders, so these genetic disorders. Um, Particularly with William and with Lily, they were following them through their life and all their, adventures and all of the complications that came up as well. So these are people's actual children. These are the lives that they're leading. Um, Now, if we look at children who have Patau syndrome and children who have Edwards syndrome, just so that you understand, if you have a baby, okay, if you have a baby developing just as a fetus inside of you that has Edwards syndrome and Patau syndrome, it's actually extremely likely, or quite likely, that they will not become a live birth. So it can be so severe that, for example, the people will not develop some of their critical internal organs. So I knew someone actually who was pregnant and their baby had Edwards syndrome, and their baby did not develop a stomach. So the mom really wanted to continue with the pregnancy, so she didn't want to terminate, and she continued, and I think at about 5 months, the fetus died. So it could no longer keep developing, and there's no way that it would have been able, that that baby would have been able to survive outside of the womb and live on its own without a stomach. Um, so she chose to continue with the pregnancy. And then she had what's called a spontaneous abortion. So that just means that the baby died inside of her just naturally. And then she had to, deliver the baby. So these things, they happen. Um, they're not extremely common. So that's actually, that's not, it doesn't happen that frequently, but it does happen, just so you know. And the severity depends from one case to another case. So when we look, I'm going to go back. Well, let's stay here for a minute, okay? We'll stay here and we'll look at some of the other ones, then we'll talk a little bit about some of these issues that come up. Let's see. When we look through the information, this one was just getting us to practice the karyotypes, so it doesn't relate to the people that we had. There were some questions about that in the other class. So a female with a normal karyotype should be 46XX. Okay, a male with trisomy 21 should be 47XY plus 21. A male with 3 chromosome number 18s should be 47XY plus 18. Okay, a female with Down syndrome should be 47XX plus 21. A male with a normal number of chromosomes should be 46XY. Perfect. Okay. So this is the real question, is why do you think people get these extra chromosomes? Okay, so I want you to try to answer that, and I actually might have us go over that in our next class because I really want to hear what you have to say about it. Okay, so how do you think that happens? Then as we continue down, this is a good image just because this is accurate, okay, that the incidence of Down syndrome actually increases with the increased age of the mother. So as the mother gets older and older, it's more likely that they will have a child with Down syndrome. Okay. Next, it says, when a person is born, why can't we remove the extra 21st chromosome from their cells? And I actually want you to think about that. Okay, carefully, based on what we talked about with the fetal development and the growth and the going from the single cell to the group of cells to even more cells, and just think about why that's not going to be a practical thing to do. And I'll hear your answers when we get back. Okay, perfect. So for now, I think that that's enough that we need to go over. There's a couple things I still want to discuss because I want to hear what you have to say. But I want to look quickly back at the karyotypes. So we saw actually that some of the trisomies are survivable. So this is just a standard karyotype. I don't think there's a single trisomy here. But if we looked, people can survive. So a fetus can survive for an extended period in the womb, and people can be born with trisomies 13, 18, 21, and trisomies and, a monosomy within the sex chromosomes as well. So that should bring up, like, why can't people, or why don't we see people with trisomy 1 or 2 or 3 or 4 or 5 or 6 or 7 or 8, etc. So all of the other ones, so if there ends up being an abnormal chromosome within the other autosomes, so other than 21, 13, or 18, that will end up as a miscarriage or a spontaneous abortion. And they say somewhere between 10 and 20% of pregnancies end in these early miscarriages. And they believe, because they can't do the testing necessarily, but they believe that that's due to chromosomal abnormalities. So having an unusual number of chromosomes, outside of the survivable areas. So really, the genetic information has to be clear in order for the baby to start developing, accurately, okay, and in a way that's going to be survivable. Okay, so we're going to go back to how we learn about the health and the genetics of an unborn baby. So the first thing, and this is just very typical, pretty much everywhere around the world, is to get an ultrasound. So many people get ultrasounds at many points throughout their pregnancy. So they use these high frequency sound waves to create these visual images of the fetus, and it includes actually internal structure, so you can see the development of the spine, you can see kidneys, you could see stomach, you can see a whole heck of a lot of details. And at one point within the pregnancy, around 20 weeks, they'll look for a couple things just to indicate whether or not there's any potential chromosomal abnormality. So they'll look, and again, they're looking for things like kidneys and a stomach to make sure that those are there. But then they'll look at this. So earlier in development, they have this little section called the nuchal translucency, and they measure it. And the size of this, or like if you measured it across, if it's very, very wide, could indicate that there might be a chromosomal abnormality within the fetus. They also look at the nose, and they try to see if there's a calcified region within the nose that would indicate that it's growing normally. Because if that calcified region is not there and they're not developing hard tissue or bone there, then they think that that could be associated with Down syndrome as well. Oops, sorry, went the wrong way. Then this is normal. So a lot of people get the ultrasounds and they get blood testing as well. The ultrasounds and the blood testing also tell you about the woman's health and if she has any risks throughout the pregnancy or things that she needs to be careful for, just to make sure that the baby is okay and will be born healthy and at an appropriate time. So if you want to go into more extensive testing, there's a few things that people can do. So they can do this chorionic villus sampling called CVS. For the chorionic villus sampling, they actually use an ultrasound, and in the meantime, they stick a hollow needle through your abdomen and into the placenta. So the placenta is that organ that makes sure that the baby's blood is actually filtered, but also that they're getting the oxygen and nutrition that they need, and they take a small chunk of it out. So this is associated with some risks. So there's a risk of infection, and there's a slightly higher risk of having a miscarriage if you complete this procedure. They also use the ultrasound pretty much to make sure that they're hitting the placenta and they don't hit the baby. This baby's pretty weird looking, I'm not going to lie. But just so you know, the placenta can be located anywhere, so this procedure might vary depending on where the placenta is located, because it would be easier if it's located in the front. So this is along the woman's abdomen, but the placenta can actually be located in the back, and then they might actually recommend doing a slightly different procedure, okay? Then there's this. So this is the amniocentesis. Oops, sorry. This is the, I'm jumping all over the place. This is amniocentesis. It looks fairly similar, except for this time they're taking the amniotic fluid. So both the amniotic fluid and the placenta contain some of the fetus's DNA, so they can make the karyotype based on that. They also use an ultrasound here for the same reason, so they want to make sure that they're getting what they need, they're not damaging the baby. And here they're sticking a needle in there, and they're extracting some of that amniotic fluid around the baby. Then this is actually fairly new. So this is this non-invasive prenatal testing, or people also call it just prenatal or fetal blood testing. So sorry, not prenatal blood testing because there's tons of that and that's just for the mom, but the fetal blood testing. So in this case, they actually take the mom's blood. So they just take blood like they would normally do if you went to the doctor for a blood test, and they look for pieces of the fetus's DNA that are floating around the mom, because some of the DNA from the fetus essentially escapes and moves through the umbilical cord and gets into her